you already start recording? Oh, okay. Well, good morning. I'm AJ and this is Anna, and we did our study on the muscle activation of the hamstrings and quadriceps during a leg press and a barbell squat, and focused specifically on women. We did our study using the EMG, which is an electromyography, which uses electrodes to see the electrical activity that a motor neuron will send to a muscle to activate it, and the electrode picks up on that electrical signal and translates it back into the iWorks machine through the EMG to show millivolts.
We looked at the hamstring and the quadriceps specifically, and this encompasses muscle coactivation, which is a simultaneous activity of muscles acting around a joint. So here we're focusing on the knee. This supports joint stability, movement efficiency, and it also assists your stabilizing muscles around that joint, and it balances pressure distribution around your knee and your joint and that whole area. And also we focused on hip and knee extension within this, and we defined it as hip extension from 90 degrees to 140 degrees to 180 degrees. And this goes the same for knee extension as well as hip extension in our exercise. And this is kind of a cool visual of mobility through stability. So if you have stability, you'll be able to move and prevent injuries, as we'll explain later. We'll be looking at the leg press and the squat, and the leg press is over there, and that's what it looks like. And we'll be looking at the up portion of the squat, and the target muscles for both of these exercises are the quadriceps, and the synergists are the hamstrings. So both of these are focusing on the same muscle groups in the same way.
To further our study to be applicable to other groups and other ways that you have to have proportional balance, we saw that it can decrease knee and hip pain and the reduce of injury through having the proportional balance between the hamstring and quadricep. So that's the first thing that we wanted to point out. Secondly, it's important to understand the importance of proportional muscle groups in the core stability. A lot of people focus on abdominal muscles, and that is not the entirety of core. You have to also focus on the back. So to reduce lower back pain or tight hamstrings, you also have to have stability through the back muscles that balance the front muscles and not just focus on one muscle group. Furthermore, you see this in other sports, athletes, and injuries in regards to the ankle. People will focus on just plantar flexion and don't spend time balancing the exercises with dorsiflexion, so they have one muscle group that's stronger than the other, and that increases your risk for injury. These are just 3 examples, but anywhere that you have agonist and antagonist muscles, it needs to be balanced in its proportion to reduce risks of injury. Furthermore, to focus on groups of people that this can affect, female athletes are at the highest risk because of their bone structure, and because it's been proven that they activate their quadriceps more than their hamstrings. So they're at an increased risk, especially for knee injury. Furthermore, any sports that use torque, pivoting, and jumping, regardless of gender, are at an increased risk because of the instability in the knee caused by the unproportional balance in hamstring to quadricep. Any athlete that has that poor proportion is at a risk for a knee injury. This leads us to our research question. We wanted to know which would cause a greater muscle activation in the hamstring between the leg press and the quadricep. Our purpose was to determine which exercise within our gym created a greater activation for the hamstring to increase the hamstring to quadricep ratio. Our hypothesis was that the barbell squat would perform and increase your activation in the hamstring. This is an exact picture taken from the leg press out in our gym. And it's very important because it says that the thighs, hamstrings, and calves are activated. So any untrained athlete that's going to just get a workout and thinks they're working their legs, they're going to see this bright red leg and assume that their entire leg is getting activated and getting a solid workout by sitting on the machine. And our data will show that this picture is not accurate. It focuses strongly on the quadriceps, and the hamstrings are only involved much later in the exercise. And so saying that hamstring group is strongly focused on and bright red language is not appropriate for somebody that doesn't understand that their hamstring is not getting a solid workout from this. Every time they sit on the machine, it's reinforcing that just their quadricep gets worked and not their hamstring. So, as I said, our purpose is to determine that the barbell squat is a better alternative for a hamstring activation.
So with the EMG, we had to be able to place the electrodes on the quad and the hamstring. The first picture on the right is what we looked at to kind of guide us in that direction. They placed 4 electrodes. We decided to do 2 in the front for the quadriceps and 2 in the back. And this is an exact picture on AJ's leg of where we placed them, and we placed them in the same exact spot on every single person. And here's the back of the leg with the hamstring. And these are more pictures of what we did. AJ's doing the barbell squat, so we put a little belt on her to hold the electrode machine, and we connected her through that. And then this is me on the leg press, and we did pretty much the same thing. It was a little more simple on the leg press, but we connected the electrodes up to this again.
Before we were able to start the exercises and collecting data, we had to first measure everybody's 1 rep max, and then we chose to use just a 70% of the 1 rep max so that it was more accurate to what you would be doing on a daily workout as opposed to your max day. So we used literature to determine what would be appropriate for a 1 rep max. Firstly, the leg press. Because we chose women that were between the ages of 20 and 29, we wanted to just get a good reading of their level of activity because it's middle and more average to anybody that walks in the gym. So we use the values 1.38 to 1.5 multiplied by their body weight, and then multiply that by 0.7 to use their 70% of 1 rep max. Oh gosh. Sorry. Furthermore, for the squat, we did the same thing. We used the intermediate level for the women, and just using their body weight, calculated what that weight would be for the leg press to put on the bar, and then just multiplied that by 0.7 so that it was 70% of their 1 rep max, and that is the weight articulated in this table. So we had 4 subjects, their body weight, 1 rep max for leg press, and then squat, and then 70% of that is what we either use the weight on the side of the leg press or put on the bar.
This is what our timeline kind of looked like. So week 1 was all about the logistics. So we kind of played around with the electrodes and the EMG machine. We were able to see if we were comfortable with it, ask any questions we had about it. We got on the leg press to see how it worked, how the weights kind of worked, and what we had to do to be able to work it properly. And we also looked at the squat and the barbell squat machine to see that we were comfortable with it. Then moving on to week 2, we were able to conduct our pilot study, and we were able to get the data for 1 subject done during this. And even through this, while working through it, we found that there were little tweaks that we had to be made that we didn't think in the logistics week. And week 3, we finally moved on to the data gathering portion where we collected the 3 other subjects' data. The variables that we used in this were the participants. So all of the participants were slightly different. Some were trained, some were untrained. So it was kind of different depending on who they were. And the dependent was the millivolts that they produced on this EMG exercise and during this muscle activation in the 2 exercises. And we collected data points in each phase of the triple extension. So we kind of eyeballed this, but we basically split up into 3 phases in both the leg press and the squat.
So moving on to our data, this first representation shows leg press of 1 subject versus their barbell squat. So this is the bulk of our study. This is what we wanted to see the difference of. If you can see just in looking at the graphs produced, there's one that has a lot more activation than the other. So you're looking at the leg press versus the squat. Firstly, it's important to see that the data represented in the first phase is such an increase of millivolts compared to any other phase. 2 versus almost 1 versus 0.3. And even in the squat, it's 4, 3, and then 1.4. This is because your muscle has to work hardest to go against gravity and move the weight. It's important to recognize that Newton's first law says not only an object in motion stays in motion, but an object at rest stays in rest unless acted upon by an outside force. You're the outside force, so your first hardest hump to get over is moving that weight. So the activation is highest in the first phase, and then you see that in the leg press, the quadricep tailors off and the hamstring comes in only at the last third of the phases. So what we saw is that the quadricep is activated throughout, but the hamstring is at 0.3, 0.2, and then finally 1. So it only comes into play the last third. Did I change it? I'm sorry. So it only comes in the last third. But then in the barbell squat, it's activated earlier. So it's 0.4, 0.9, and then 1. So it starts having spikes because it's being activated sooner in the squat, which means you're getting a better hamstring workout. And the numbers are better related in a hamstring to quadricep ratio in the squat versus the leg press.
Then we compared a leg press of our second subject and the leg press of our fourth subject, because we noticed that the fourth subject, their data was quite a bit different than the other three subjects, and this kind of got us wondering, why could this be? So we decided to compare the leg press and the barbell squat in both of the normal ones, or like the more typical ones in our study, and to the F4 ones to see what the differences were. And so we realized that in F4s, they were more balanced. So if you look at, this is F2's quadriceps and hamstring, and F4 quadriceps and hamstring, you can see that the hamstring in F4s is activated much more consistently, and it gets activated in the second phase rather than the third phase in F2. And the quadriceps aren't activated quite as greatly. So it's more of a balance, and it's more proportional to that proper H to Q ratio. And we kind of hypothesized that this could be because subject F4 had more training with their hamstring, so they could more properly activate that versus the other untrained subjects in that specific area. So next we looked at the barbell squat, comparing these same two subjects again. And this one was a little bit more similar, but you can still see that in the beginning, or throughout the hamstrings in the barbell squat on subject F4 is pretty consistent. So the hamstrings are consistently activated, whereas with subject F2, it starts pretty low and the hamstrings get activated much greater at the third phase. And the quadriceps are only mainly really active in the first phase of subject F4. So this was kind of interesting. And we, again, kind of related this back to maybe subject F4 being more trained in the hamstrings, so they were able to activate the hamstrings sooner and use them more throughout because they had a higher H to Q ratio.
So moving past just the data, but to be able to apply it and explain it to you guys, firstly we wanted to point out that using the H to Q ratio, there's not specifically a normal range, or there's not a normal comparison because it's a wide range. What they usually say in the literature is that you want H to be 50 to 80% of Q. That is the expected value. However, that range is large, so it's hard to take our data and say it's in it or it's not because it's a wide range. But furthermore, it's important that the H to Q ratio is lower in women because it's expected that they activate their quadricep more than their hamstring just because of their bone articulation. So just to know that if we were to use men when further in this study, we'd have to have a separate range for men and women. To take our data and put a blanket statement over it, it's important to know that hamstring activation is greater in the leg press, is greater in the squat. And taking our data, it follows that as it says in the literature, that the hamstring activation is going to be greater in the squat than in the leg press. And this is because using free weights requires more muscle activation of stabilizing muscles. Not just are you focusing on the quadricep group or just the hamstring group, but throughout, going down and up, you're using every other muscle that stabilizes your ankle, knee, and hip joint to hold that weight. So everything's getting a better workout rather than sitting in a confined leg press that moves in through the range of motion that the machine allows rather than what you'd allow. So you get a better workout that activates more muscles, including the stabilizers, through a free weight squat. And what this means is that stabilization will have less risk for injury.
So to conclude this, we saw that the barbell squat had a greater hamstring activation, and this created a better H-to-Q ratio like we saw and like we had just talked about. So the barbell squat should be utilized more, and the leg press was mainly the quadriceps when we saw it, so it wasn't really affecting the hamstring. So this kind of shows that this could be hurting your H-to-Q ratio, and this is more of a reason why you should go to the barbell squat over the leg press. And women specifically, like we looked at, should stay away from the leg press and focus on the barbell squat for all the reasons that AJ just mentioned, for stabilizing your muscles and for getting an overall better workout, as well as maintaining a proper H-to-Q ratio. Some limitations of our study was the electrode placement. We kind of adapted from one version to kind of our own version, and I think that something we could do if we were to do this again is figure out better electrode placement and maybe try different electrode placements and see what effects that would have on our results. Also, another limitation was the subjects that we used. They weren't all on the same training program, so this could have affected the results as well. So using more consistently trained or untrained subject and choosing a more consistent population would have provided more consistent results. Also, we didn't really conduct a true 1-rep max test or MBIC. We went off the tables as we described, so maybe if we did a true 1-rep max test, this would have been able to normalize our data even more so. And lastly, we did not pace these exercises. So in other literature that we read after we conducted the experiment, they had used a metronome to pace the leg press and the barbell squat. And we also kind of eyeballed the 3 phases that we looked at. So if we were to do this again, we could be more consistent in these areas. So some take-home messages from this is to, again, choose the barbell squat over the leg press, and more so choose free weights in general over machine training. It might be easy to go to the machines, especially if you're new to the gym. They might seem more comfortable and easier to perform, but what a lot of people don't realize is that this might be affecting you negatively because you're not using your stabilizing muscles and you're not creating that overall balance, and that these machines, while they may seem easier, they might be hurting you in the long run. So even if you're not comfortable with the free weights, you should ask somebody. You can also look up videos and see how to best perform them so it doesn't affect you in the future. You also want to focus on overall muscle balance. We learned through this and through looking through the literature that this is very important. It's very important in the prevention of injury, but also on the rehabilitation side. So athletic trainers, a lot of times if you get an injury, they want to focus on getting that balance back and working out the muscles that are lacking in strength compared to other muscles. So you want to keep these ratios pretty close. And we learned that women should focus on hamstring strength even more so than quadriceps because of this proper H-to-Q ratio, and that a lot of times women are lacking in hamstring strength. And a lot of times women in training also focus on acceleration more than deceleration. So when you decelerate, you're using your hamstring more, and a lot of the knee injuries are caused during deceleration in women's sports. So if your hamstring's weaker, you are more likely to cause these injuries. So this is even more why that women should focus on this. And this is kind of a cool visual of it. A girl is just landing, and this is a form of deceleration, and she gets a knee injury. So overall, women should focus on this, especially in sports with jumping, pivoting, and torque. Those are references.
Do you need us to go back to any of the data or anything?
Let's see, what kind of questions do we have? Good morning.
Yeah.
Okay, I have a question. And so it's regarding the EMG testing you did. Is proportionality, was that, you're saying it's proportional based on millivolts or proportional to strength? Or are those two kind of one and the same?
Well, millivolts specifically shows how much muscle activation is there, and the activation is what produces the contraction to apply force. But the ratio would be in the millivolts produced.
Okay.
You
And,
want them to be closer to 1-to-1, although they know that in women that's not likely. They want it closer to 80% then, if the hamstring is 80% of the quadricep.
So somebody can have sort of like proportionally strength muscles in a sense, but have a disproportional activation, I guess is what you're saying. You know, like, does that make sense?
Yes.
When I picture, I feel like usually if you're activating those muscles, like you also might be stronger in those areas too. Like if you're not working them, not using them, they're not going to be activated, so they might not be as strong because of that.
And then the second part is, I don't know, maybe would in your quadricep press muscle, like I think of it as like almost completely a quadricep exercise, you know? And whenever you're relaxing, I would think that millivolts would stay high because of inhibitory signals, kind of like telling it to let off. So do you think that the inhibitory signals of either muscle group may have skewed your data, so to speak?
Well, you can see at the beginning of our things, our graphs. Yeah. It starts out, we first started the EMG, like for example on this one we kind of cut off, but before it was also consistent like this. So you can tell when the subject's just at rest that it was even and that it wasn't like getting any muscle activation signal.
And afterwards, there's still few spikes, like, 1, 2, and 3. That's where they have come back and, they're not moving anymore. But we measured specifically from when they started pushing to when they got to 180 degrees. As we said, that was the triple extension. So even when they were fully extended, they still had, as you're saying, a little bit of activation, as seen in the spikes, 0.33 compared to 2. I know. I was so excited. Jordan?
Do you guys think that change in activation ratio will happen just as utilization of both muscle groups goes up in general, or do you think that it will happen due to proper training? Like, do you think someone, even though they might use them all the time, but can train to the effect to be dominant or non-dominant over the other, or that just that activation is the responsible thing for that nice ratio?
Well, what we see is that the activation occurs because of which muscle group is used prevalently. So women more often use their quadriceps, which increases their activation in it. So as you're saying, proper training would be the perfect way to increase your hamstrings activation, because especially for the leg press, your hamstring doesn't do more work because the quadricep does. Does that make sense? So if you could, the reason why squats are so important is because those stabilizing muscles will take some of the work away from the quadriceps to do, whereas when you're in the leg press, just your quadriceps are doing something. So to increase activation, as you said, proper training would be important so that other muscles have the chance to increase their activation. If they get worked more, then they'll be more keen to activate when they have the opportunity to.
And that's why we kind of hypothesized that with subject F4, when their hamstrings were activated earlier and greater, we thought that this was because of the training on the hamstrings prior to testing. So I guess it would be interesting, we could have seen if we had more time at the beginning and then having them train and then see the effects afterwards if we would have had more time to actually show that.
Very interesting.
Do you think that's a lot from voluntary or involuntary? Like the person who's doing that knows, okay, well, I perform better when I activate my posterior muscles at the same time, or is it like an involuntary, just kind of, your body's just kind of taking over?
I don't think it's involuntary for most people. I guess it could be turned into voluntary, like a study that we looked at for The other class, they actually use verbal cues to activate those. So I guess you could control it in that way and see if that had an effect. But for ours, we just told them to do the leg press. I think our subjects were more focused on just completing the exercise. So involuntarily.
Yeah, there are a lot of variables I think we have to account for if we were to move forward with more research, because we were just getting data in this study as opposed to, knowing how to use the data at first. And so the metronome specifically was seen again and again in literature because we chose, the 90, 140, and 180 for triple extension, but we were just standing there like making sure they did it as opposed to it being paced. You got to one phase, the second phase, and then the third phase through a time-based, constraints so that everybody was the same, whereas we just kind of looked and said, okay, she got through phase 1, phase 2, phase 3, and we just saw with one person kind of cueing the person at the computer where the phase started and stopped. So that's something we can improve. But it took reading the literature for 347 to know how well the study could have been for 307.
If you talked a lot about some like movement patterns and big picture things, which is really good, but what, some of the basics, what are those three planes of movement? We talk about human movement.
Do you mean sagittal, frontal, and transverse?
That's exactly what I mean. Which is which?
Sagittal, transverse is top and bottom, and frontal is front and back.
So if you focus on your knee and your hip, which would be, so at the knee joint, what would be sagittal?
Left and right.
But if you were to make the knee move,
The
you're in the sagittal plane with the knee.
in and out kind of.
Would it be flexion and extension, or?
Oh, it follows, okay, wait, it follows the axis, so front, back,
There you go.
forward and backwards, it
Yeah.
follows the axis.
What would be frontal plane movement? That'd be good or bad, frontal plane?
Bad, you don't want it to go like that.
Right. And then how about transverse? Does it have some capability in transverse?
That would be bad.
But that would be rotational.
Yeah. And it has a little bit,
Yeah.
but not a lot.
Yeah.
Yeah, so I think that's a good place to think about those planes to begin with. And if you look at the hamstring and quadricep muscles specifically, which muscles are we talking about
Name them all. Okay.
Like where we placed our electrodes?
here? That would help you.
Okay.
Looking for 6, really. 3 posterior, 3
The
anterior.
quadricep, we looked at the rectus femoris, and then the vastus medialis and vastus lateralis. And the hamstring group, it was the bicep femoris, semitendinosus, and semimembranosus.
Got it. And then triple extension, we talked around that term a little bit, but what is triple extension?
The literature was very left and right wing. A lot of what like sports medicine and strength and conditioning literature said was that it was the simultaneous movement of the ankle, knee, and hip, which was different than what we thought it was when we were sitting on the leg press. So what we saw was that there was an MAV concept that was 3 periods based on degrees of hip and knee extension. And so that's where we got the 90, 140, and 180 from.
Yeah, in like movement-based literature, you'd be talking about the first thing, the simple one. Just
Yeah.
hip extends, the knee extends, the ankle extends. But when we call it extension of the ankle, what do we really call it in anatomical sense? And would be, which one's dorsal, which one's
Plantar
plantar?
flexion, like yeah, when you push down.
Yeah, if you
push.
It'd be plantar flexion. Sometimes that's confusing too, because it's plantar flexion, but we call it it's part of triple extension. Yeah, good. How important is triple extension in like competitive sport environments?
It's very important. It increases the force production because everything is applying that contractional force at one time as opposed to one and then the other. so that all the motion possible goes into one play or one movement as opposed to kind of, sequential.
And if, especially near the end, you gave us some very good thoughts about acceleration and deacceleration. But if you look at the knee joint specifically, if the